So as we start to reopen surgery, several things have been taken into consideration. We've had careful talks with our inpatient colleagues on the resources they need, including staffing and PPE. We cannot do anything to detrimentally affect those patients who are already in the hospital, as well as those caregivers. As we move along in starting surgery, we're going to start really slow. And that's because we want to make sure that the most urgent patients are done first. But we also have to look at our resources. We've got to make sure that we don't burden our system and the patient that comes in is not negatively affected. The reason elective surgery was suspended more than anything else is safety of patients in terms of social distancing. But certain things are on a more emergent or urgent basis. That has to be done, and the gain of that outweighs the risks of social distancing and spread. But elective surgery, whether you do it today or you do it in 2 months, if it's not a hugely impactful situation such as many of the cancers or fractures or emergencies, we can put those off for a while and still there's no negative long-term consequences to the patient. But if we bring those patients in too soon and either resources aren't available or the COVID outbreak increases, we have done a disservice to both the patient and society. Some of those cases that have really been waiting patiently that need to go now are being done. And as we work through the remainder of the month, we want to slowly ramp up, but with being cautious. We have to make sure that we do not affect our inpatient census and our caregivers who are caring for those patients who are both COVID and non-COVID positive, as well as carefully monitoring our personal protective equipment. Rest assured, everybody's going to get done over time. We are just trying to make sure we get the patients with the most urgent or serious conditions done first, but everybody's condition is important. So as we restart surgery, an order or a rationale has been created. And this is a tier or scoring system that our network is using. This is based on hours of research across the United States, and then allocating those rooms and operating rooms and resources to those patients who have waited patiently for cases that didn't need to be done emergently 6 weeks ago, but now has come to a time where they have to be done.